Stop. Before you scroll past this video, I need you to do something. Look at yourself in the mirror. Go ahead. I will wait. Now, what do you see? Your face? Your hair? Maybe a new wrinkle you are worried about. But here is the thing. While you are checking your appearance, your body is literally broadcasting warning signals that you are completely missing. And I'm not talking about vague symptoms. I'm talking about visible physical signs that are hiding in plain sight every single time you look in the mirror. These aren't just cosmetic quirks. They are your body's emergency broadcast system. And most people ignore them until it is too late. I'm Abraham, and today we are diving into 5 medical mysteries that are staring back at you from your own reflection. By the end of this video, you will never look into the mirror the same way again. And one of these signs could literally save your life. So let's get into it. Before we jump in, let me ask you this. Have you ever noticed something weird about your appearance and just brush it off? Maybe you thought, oh, I'm just tired. Or it's probably nothing. We all do it, but here is what medical professionals know that most people don't. Your body doesn't lie. When something is wrong internally, whether it's your liver, your blood, or your metabolism, your body sends off flares. The problem is that we have been trained to ignore them. Today we are talking about 5 specific signs that most people dismiss as harmless, but are actually red flags for serious health conditions. We are talking insulin resistance, anemia, liver disease, and nutritional deficiencies that can spiral into life-threatening complications if left unchecked. And the scariest part, these conditions are often silent. No pain, no obvious symptoms, just subtle changes in your appearance that you see every day but never think twice about. So let's break down these 5 signs, what they mean, and what you need to do if you spot them. Alright, sign number 1, Acanthosis Nigricans. Now, I know that sounds like a spell from Harry Potter, but stay with me, this one is crucial. Have you ever noticed dark velvety patches of skin on your neck, armpit, or groin? Maybe you thought it was just dirt that wouldn't wash off, or a wire tan that won't fade. A lot of people scrub at it in the shower, thinking they are just not cleaning well enough. But here is the truth. That is not dirt. It's called Acanthosis Nigricans. And it is your skin literally changing texture and color because of what is happening inside your body. What it means. So what causes this? Acanthosis nigricans is most commonly linked to insulin resistance, the precursor to type 2 diabetes. When your body becomes resistant to insulin, your cells stop responding to this crucial hormone that regulates blood sugar. Your pancreas then pumps out more insulin to compensate. And this excess insulin triggers skin cells to reproduce abnormally, creating these dark, thick patches. Think of it like your body's check engine light, but instead of a dashboard, it's written on your skin. And here is the scary part. Insulin resistance doesn't just lead to diabetes. It's also associated with heart disease, fatty liver disease, and even certain cancers. But in the early stages, you might feel completely fine. No symptoms, just these dark patches that you've been ignoring. What to do? If you are looking in the mirror right now and seeing these patches, don't panic, but don't ignore it either. This is a sign that you need to get your blood sugar and insulin level checked. A simple fasting glucose test or AIC test can tell you where you stand. The great news. If caught early, insulin resistance is reversible through lifestyle changes, diet, exercise, and weight management. But you have to catch it before it progresses to full-blown diabetes. So take a close look at your neck, armpit, and knuckles. If you see dark, velvety skin that wasn't there before, it's time to call your doctor. Sign number 2, conjunctival pallor. And this one is wide because it's hiding right behind your eyelids. Here is what I want you to do. Gently pull down your lower eyelids and look at the inner lining, the conjunctiva. Is it a healthy pink or red color? Or is it pale, almost white? If it's pale, you've just discovered conjunctival pallor, and it's one of the most reliable physical signs of anemia. Let's talk about what this means. Your conjunctiva, the tissue lining your eyelids, is packed with tiny blood vessels. When you are healthy, those vessels are full of oxygen-rich red blood cells, giving that tissue a vibrant pink color. But when you are anemic, your body doesn't have enough red blood cells or hemoglobin to carry oxygen efficiently. Those blood vessels become depleted and the tissue turns pale. It's like the color is literally draining from your body. Iron deficiency. Anemia is the most common cause, but you can also see this with B12 deficiency, folate deficiency, chronic bleeding, like from ulcers or heavy periods, or even more serious conditions like bone marrow disorders. And here is why this matters. Anemia isn't just about feeling tired. Severe anemia can lead to heart problems because your heart has to work overtime to pump oxygen depleted blood throughout your body. It can affect your brain function, your immune system, and in pregnant women, it can cause serious complications for both mom and baby. But here is the thing, most people with mild to moderate anemia don't realize they have it. They just think they are tired because of stress or busy schedules, or not sleeping well. They normalize the fatigue, the weakness, the brain fogs. Meanwhile, their body is literally showing them the problem every time they look in the mirror. They just don't know what they are looking for. What to do? So right now, pull down your eyelids and check. If you see pale tissue instead of pink, especially if you have been feeling unusually tired, weak or short of breath, you need a complete blood count, a CBC test. This simple blood test will show your hemoglobin levels and help identify the cause. And if it is iron deficiency, the fix might be as simple as dietary changes or supplements. But you need to know the root cause because sometimes anemia is a sign of something more serious that needs attention. Sign number 3, jaundice. This is one you've probably heard of, but you might not know how to spot it in its early stages. Look at the whites of your eyes, the sclera. Are they bright white or do they have a yellowish tint? Now look at your skin under natural light. Is there a subtle yellow or greenish tone, especially on your face, chest or palm? If you are seeing yellow where there should be white, that's jaundice. And is your liver waving a giant red flag? Jaundice happens when bilirubin, a yellow pigment produced when red blood cells break down, builds up in your blood. Normally, your liver processes bilirubin and eliminates it through bile. But when your liver is damaged, diseased, or blocked, bilirubin accumulates in your tissues, turning your skin and eyes yellow. This can be caused by hepatitis, viral infections that inflame your liver, cirrhosis from chronic alcohol use or fatty liver disease, bile duct destructions like gallstones, or even certain medication and toxins. Here is the critical part. By the time jaundice is visible, your liver is already significantly compromised. Your liver is an incredibly resilient organ. It can lose up to 75% of its function before you notice symptoms. So when jaundice appears, it's a sign that you need immediate medical attention. What to do? If you see any yellowing in your eyes or skin, Don't wait. This isn't something you monitor at home. You need blood tests to check your liver enzymes, bilirubin levels, and imaging studies to identify the cause. Liver disease is progressive, but if caught early, many causes are treatable or manageable, but time is critical. Sign number 4, spider nevi. These are small red spots on your skin, usually on your chest, face, or arms that look like tiny spiders or starburst, with a central red dot and thin red lines radiating outward. You might have one or two and think nothing of it, but if you are noticing multiple spider nevi appearing, especially if they are clustered on your upper body, this is a sign you need to take seriously. Spider nevi are dilated blood vessels near the surface of your skin. They are caused by increased estrogen level, which can happen during pregnancy or from certain medications. But they are also strongly associated with chronic liver diseases, particularly cirrhosis. Here is why. When your liver isn't functioning properly, it can't metabolize estrogen efficiently. This leads to estrogen building up in your bloodstream, which causes these characteristics vascular change in your skin. The appearance of multiple spider nevi is actually part of the diagnostic criteria doctors use to assess liver health. It's your body's external manifestation of internal liver dysfunction. What to do? If you are seeing this spider-like red spot appearing on your skin, especially along with other signs like jaundice, abdominal swelling, or easy bruising, you need a liver function assessment. This includes blood tests for liver enzymes, imaging like an ultrasound or fibroscan, and possibly a consultation with a hepatologist. Liver disease is manageable when caught early, but it requires medical intervention. And finally, sign number 5, atrophic glossitis. This one is hiding right in your mouth. Stick out your tongue and look at it closely. A healthy tongue has a slightly rough texture with tiny bumps called papillae. But if your tongue looks abnormally smooth, shiny, or even swollen and red, that's atrophic glossitis, and it's a sign of serious nutritional deficiencies. Atrophic glossitis occurs when those papillae on your tongue disappear, leaving it smooth and inflamed. This is most commonly caused by deficiency in vitamin B12, iron, or folate nutrients that are critical for healthy cell production. B12 deficiency can lead to nerve damage, cognitive decline, and pernicious anemia. Iron deficiency causes anemia and fatigue. Folate deficiency can affect DNA synthesis and is especially dangerous during pregnancy. And here is the catch. This deficiency don't just affect your tongue. They affect your brain, your blood, your nervous system, and your overall energy levels. But your tongue is the early warning system. What to do? If your tongue looks smooth and shiny, get tested for B12, folate, and iron levels. These deficiencies are flexible with supplement and dietary changes, but you need to identify the underlying cause, whether it's malabsorption, dietary insufficiency, or an autoimmune condition. So there you have it, 5 signs your body is broadcasting through your mirror every single day. Dark patches you thought were dead, pale eyelids you blamed on tiredness, yellow eyes you convinced yourself we are just lighting, spider veins you dismiss as aging, a smooth tongue you never thought twice about. These aren't cosmetic issues, they are your body's check engine light written in biological code. So here's what I want you to do right now. Go to your mirror and check yourself for these 5 signs. Take your time, really look, and if you even see one of these warning signals, don't wait. Screenshot this video, share it with someone you care about, and book an appointment with your doctor. Your body is talking to you. It's time to listen. If this video opened your eyes, hit that like button, subscribe for more medical mysteries, and drop a comment telling me which sign surprised you most. I see you in the next one. Stay healthy, stay curious, and never ignore what your mirror is trying to tell you.